Um, Pandemics really can impact everyone severely, but people who have been historically underserved suffer much more during a pandemic. We have seen, especially early on in the pandemic, that our Black and Brown communities contracted COVID at a higher rate. And back then, when we didn't have vaccines and we weren't really sure of the treatment, they really suffered more in terms of just hospitalization and death. And we also know that many of our communities don't have good access to regular health care. And so as we rolled out the vaccinations initially, those communities really had lower vaccination rates. So as a state, we constantly look at our vaccination rates and look at them by demographic group as well. And so when we see areas that are under vaccinated, we make sure that we increase resources to that community to make sure that we catch up in terms of those rates. So we have seen that in some areas where African Americans were less vaccinated, over time, we had higher vaccination rates in those areas because of those efforts. And those efforts were partnering with local grassroots organizations, houses of worship, other civic groups to do pop-up clinics in those areas, or to make sure that the providers who were already in those areas had vaccine to be able to administer. We also partnered to do mobile clinics. We've, especially in the Hispanic community, we've worked with Hispanic providers as well to make sure that we're providing information in a language that people could understand, providing information from a trusted messenger that they can relate to. So a lot of outreach efforts like that to make sure that we are getting to the populations, especially populations that were more highly impacted, to make sure that they are getting vaccinated at least to the level of their population.